spoke to Dr. Patt Franciosi for more on World Mental Health Day. She is the past president of the World Federation for Mental Health. I asked her about the most promising changes we've seen so far since the movement began 23 years ago.
I believe that we have made significant advances in research and services and pharmacological interventions. It's not enough, but it has progressed the field. We are still battling with the stigma and discrimination that surrounds people who are experiencing mental illness, and we are working diligently to combat those misperceptions about mental illness.
So we are learning about what China is doing to try to get more treatment to the estimated 100 million mental health sufferers there. What would you say are some best practices, especially for developing countries around the world?
Well, there needs to be a greater emphasis on providing mental health care workers. In many parts of the world, and Asia is significant among them, there's less than one psychiatrist for our 100,000 people. Well, we know that millions of people around the world don't get the care that they need, particularly because there are not people to provide that care. So significantly, we want to get more people trained and to integrate mental health care into primary care. There are about 450 million people worldwide who are suffering today from a mental illness. And yet governments around the world provide less than 1% of their health care funding for mental health. 33% of countries around the world provide less than 1%. Well, that's inadequate. We can't deal with the problems unless we make a concerted effort to get programs and policies in place that puts mental health on a higher priority than it is currently.
There's also been this strategic shift away from hospitalization in some countries for severe mental health cases, but you say there are some real tough consequences to doing that. How does the health system and the community need to prepare if that's the way the government is headed?
We believe that a person being released from a mental health facility needs an advocate. They need somebody to work with them to navigate the system, to find them a psychiatrist or a mental health care worker that can monitor their medications, to provide support to the families who are often overburdened by taking care of their loved one, to provide them with opportunities for supportive housing, to provide them with employment when possible. So for countries that are planning on deinstitutionalizing, they must have those programs in place before they release people to the community. And what we know is that recovery is possible, and we don't want to impede anybody's ability to recover from their mental illness. But what we also know is that they oftentimes can't do it alone. So it's like having somebody walk with you until you're able to walk totally alone. I would like to say that if anyone wants to know more about World Mental Health Day and the Dignity Project that we're working on this year, please visit WFMH.org. Join us in our fight to combat the stigma and discrimination and to help some of our most vulnerable people globally.
Well, Dr. Patt Franciosi from the World Federation for Mental Health, we thank you for your time.